Hello dear students, I am Dr. Dharmendra Singh, Psychiatry faculty in PW MedEd. Today we are going to discuss that the pattern of psychiatric MCQs in INICET, and we'll try to compare it with the NEET PG or other exams. As I always say in my classes, in videos, that in Indian exams they don't change the topics, they change the MCQ. And this INICET paper was again the proof of that, those words. If you see the INICET psychiatric MCQ, this time they asked roughly around 8 to 9 MCQs. Yes, in NEET PG the MCQs were around 12 to 13, but you will see the pattern of psychiatric MCQ. The same topics were repeated. Usually see in psychiatry, we start from the dementia. Usually they ask one or two MCQs from the dementia. This time also they ask. See, uh, dear students, try to understand the good thing. If you can guess the topic, this is a good thing about topic. Okay, this is a hot topic. But what is the bad thing about hot topic? That the multiple MCQs already have been asked in this topic. So basically they try to ask the new and new things, and sometimes this new and new thing become a little difficult MCQ. They usually ask in dementia, sometime reversible, non-reversible, that treatment. This time they ask that treatment, that if orally you are not able to take medication patient, then what? So they usually they try to ask which antidementic drug which is available in patch form. You see the lithium, in many time, I in a lighter way I usually say that if lithium MCQ will not be there, it means paper is going to cancel. And same thing this time happened. If you last 10 years paper, you will see lithium 1 MCQ always they ask. This time also they asked. This time MCQ was little difficult about lithium, but that we already discussed in our MCQs, so you can go and check. Another MCQ, TCA toxicity. So again, the antidepressant, one or two MCQ they asked, was the same topic was there. TCA toxicity multiple time have been asked. This time also they asked, and the question was not very tough. Addiction psychiatry, yes, sometimes they ask from the alcohol, nicotine, opium. This time they ask the treatment, the stages of the treatment of dependence. So if you'll see the MCQs, mostly the same topics were there. You will see the mood disorders, depression, mania, the mood stabilizer they usually try target. Lithium, yes, they already I discussed that they targeted. But yeah, another mood stabilizer, this time they valproate again, they ask. So if you see the psychiatric topics, we start from the dementia I mentioned. If you'll see the schizophrenia, in schizophrenia also usually they ask about the diagnosis. Many times they ask about the the drugs, the antipsychotic drugs, either typical, atypical, or their side effects usually they target. If you'll go in a mood disorder, many times the diagnosis about the depression, dysthymia, so mood disorders, or they ask the mania, the duration, the symptom you should know, and the treatment. Important part, the psychopharmacology, usually the it has been asked since many years, and again it is going to ask in a future. So be very careful about it, that antidepressant they ask and the mood stabilizers they ask. Sometimes they ask the which antidepressant which group, or sometime many a time they ask about the side effects, and the nowadays the clinical correlation, pregnancy, which is safe, which is not safe, how you can prescribe. Then the anxiety disorder, usually they ask about this panic disorder. Then they will give you that which investigations you would like to do, which not. Then we'll go further, the child psychiatry, again the ADHD they target, the mental retardation, autism. Then this dissociative disorder, sometime one MCQ from the either dissociative disorder, somatoform disorder, the malingering, the factitious disorder. So the areas are fixed in psychiatry, or I think not only in psychiatry, in many, almost all 19 subjects, if you see, they don't change the MCQs, they don't change the topics, they just change the MCQ from those topics. So hot areas were the important thing in previous years also, and the hot and or important topics are the concern of current time as well. So as a faculty, I will advise you in psychiatry that number one, have a good concept about the diagnosis, that what are the criteria in the diagnosis, and the duration usually they ask in depression, mania, schizophrenia. Then the second part is the antipsychotics. You have to cover very nicely their side effects, their groups, and the antidepressant, their groups and the side effects, and the toxicity, TCA toxicity, frequently asked MCQ, and the mood stabilizers, lithium, valproate, oxcarbazepine, carbazepine. The examiner is behind these drugs. This time the 3 MCQs have been asked from these mood stabilizers. Okay, so and then the further child psychiatry, yes, very important area. The more and more research is coming, so they ask this area as well. And the 1 MCQ they usually target from the this neurotic and stress related disorders. You have to be thorough. And sometime, yes, one MCQ, although it's a small topic, but they ask eating disorders, anorexia nervosa, bulimia nervosa, and the sexual disorder. So overall you have to cover nicely. But yeah, these areas, the diagnosis, the duration criteria, the medications, the drugs in psychiatry, and their side effects, usually they target. And nowadays they started asking about the scales. So we have a qualitative assessment in psychiatry. We patient is in front of us, we take a history and we make a diagnosis. But please remember, we also have a quantitative assessment, that how to measure that how much depression is there, whether it's a mild, moderate, severe, and whether there is a eating disorders or not. So there are various scales we have in various psychiatric disorder. These MCQs they started asking, already started. So in my videos also, in classes also, I discuss. So this is, I think, will be the new area where they will approach, or they will focus more. So in psychiatry, please, as I always say, and again today will repeat, that basic and minor subjects are the backbone of any exam, including INICET. Yes, before the AIMS was taking this separate exam, PGI separately. Today now they merged it, but yes, there every exam has a own question bank. So the previous year's MCQs are the very important one. So previous years, the chunk of the at least 4 to 5 years MCQs, uh, read them, those topics, be thorough with them. And when you are like reading the hot topics, then see the MCQs simultaneously, and then try ki, okay, these MCQs have been asked already, and as a smart student, try to understand ki what else can be asked. So this time you will see, in lithium they ask everything, the level of lithium, the side effects of lithium, whom you have to prescribe the lithium. And this time they correlated with the pregnancy, that in third trimester, and what you will do, you will increase the dose or the decrease the dose. Same here, that valproate they ask many time, and again they ask the hyperammonemia, the side effects of valproate. So the basic, the dementia wala, many time they ask the antidementic drug, and this time they ask which antidementic drug come in a patch form, apart from the like oral tablet. So they go little further. So as a student, you should be thorough, you should know what's the hot topic, what are the concept of the hot topic, and try to guess in that. So if you'll see last 5 year papers, 10 years papers, every time the same thing is there, that they target the hot topic and they go little further. They go little further. Even when we were preparing, we used to see in pathology Robbins, and the initial 7 chapter, the cell injury, inflammation, every, okay, this has been asked. This time they can ask this thing. And it was the like we used to even guess, and sometimes these MCQ used to come, the same MCQ. So this is as a smart student, that the previous year's MCQ you should focus. You should know the whole, the what areas, what are the important areas of a particular subject, including psychiatry. And then you can start guessing also. Once you have a good hold on these MCQs, you can guess also that, okay, what in future can be asked. So this time in INICET, again I will say that same areas were repeated, no new area, same topics were there, only the MCQ they changed from this area. But yes, compared to the NEET PG, 3 4 MCQs were less in the INICET. But yes, in psychiatry, usually between 8 to 11 MCQs they usually ask, 9 10 11. In NEET PG, the previous wala, in this, yes, there were 13 questions, so 1 2 questions even more, but 9 to 11 questions you can expect from the psychiatry. And areas, as I mentioned, these areas they are targeting. So please don't ignore the minor subjects, particularly these minor subjects, where you don't have a like psychiatry you have to read, you will not get a help from any other subject. So this type of subject you should not ignore, because putting a less effort and doing the 8 to 10 MCQ is always fruitful, because the time is always a concern, that time we don't have much time, always time is less for preparation. So try to target those subjects where you have to put the less effort and the maximum output. Okay, thank you.